Welcome back. It's time for your health segment. And now joining me in studio, we have with us Dr. Jill Mutua. Thank you for joining us. She's a clinical pharmacist, as well as Dr. Nchagwa Chacha, who is an epidemiologist. And we will be looking at the ongoing campaign that is there in terms of trying to ensure that we manage to bring down what they call antibiotics resistance. The fact that a majority of us are always tempted to always pick antibiotics just from the chemist, but we don't really think about the repercussions. And sometimes when you go to hospital and you're prescribed for antibiotics, you don't really get to finish your entire dose. Why is this bad? They will be telling us that just now. Thank you, gentlemen and lady, for coming to our studios.
Thank you.
And I want us to begin from the point of the statistics before we look at the ongoing awareness campaign. What is the level of antibiotic resistance?
Now, antibiotic resistance is an issue that is emerging. And according to World Health Organization, the current statistic that we have, we estimate that in the year 2050, about 10 million people in the world will be dying due to antimicrobial resistance. So much on research is still going on. We don't have much data as per now, especially in Kenya. Very few research has been done to have concrete statistics. But we're just using that figure, and one of the objectives that what we call the antimicrobial resistance policy has is to invest more and do a lot of research. So much research is going on, and as you know, with antimicrobial resistance, the research takes time and it's also costly. So we may not have concrete figures as per now as the country, but maybe in future we hope to have concrete figures. Yeah.
Why is there a concern that perhaps, or rather the feeling that there is a growing resistance to antibiotics?
It's actually a worldwide trend. Back in the 50s, when we didn't have antibiotics, people could die from all sorts of diseases. And then we discovered antibiotics, and for 80 years we have longer lives, better lives, even in the third world. Because now we have more drugs, they are cheaper, they are available. But the problem with antibiotic resistance is when we overuse, underuse, or abuse those drugs, then you find that the microbials, in this case bacteria, they become resistant to medication that was once effective against them. And that poses the risk of taking us back to the 50s, where we have diseases that we cannot manage, we cannot treat, because the agents which we used before are not effective anymore. Yeah.
When she talks about misuse, underuse, overuse, what does she mean by that?
That simply means that, you see, when you're sick and you're advised to go and see a doctor, and a qualified doctor for that matter.
Not a quack.
Yeah, and especially, and even not only in humans, even animals. When your animal is sick, you are supposed to seek advice from a qualified veterinarian or veterinary paraprofessional. So once you go see a doctor and the doctor prescribes some medicine for you, the doctor will tell you the quantity that you are supposed to take, the length, quantity in this case means dosage, and the duration of which you will take those medicines. You are supposed to adhere to that. Take the right quantity, dosage, and also the duration of time, the duration that is prescribed by the doctor. So if the doctor advises you to take those medicines, maybe 2 tablets twice a day for 1 week, and after taking those medicines for 3 days, you feel you're okay, and you stop taking, that is already misuse. And that's actually underuse. If you share this medicine with others, maybe you saw your relative or friend has the same symptom that you have, you feel you're better and you share that medicine with the other person, that is misuse. And if maybe you finish the dose and you feel like you're not better, you're not feeling better, you go and buy more those medicines without the doctor's advice, that's overuse. So such kind of practices and behavior are what leads to antimicrobial resistance. Because the doctor had very good reasons why he described them in that manner. So you find that in the long run, this bacteria will get used to these antibiotics. So next time when you are sick or somebody else is sick and you share the medicine with, then once they take the same medicine, that disease will not be cured. And therefore we'll end up having simple diseases that the medicine we used before, the medicine that used to cure them before, can no longer cure them. And remember, very little research is going on at the moment concerning antibiotics. The last antibiotic to be researched on was in the 1980s. Since then, there's no new antibiotic being discovered.
Yeah.
So if we continue with this trend, we'll have common diseases killing us, but the medicine that used to cure them before cannot cure them. Yeah.
But even as he talks about that, it brings me back to the debate that we keep having every time about the generic medicine, the original medicine. Where does that all fall into this discussion?
Okay, maybe I can go a step back when he talked about we seeing a doctor. Antibiotics should be handled should be given on prescription. By prescription, it means you need to see a doctor or a clinician, in that case, if the doctor is not available. And the doctor should make the right decision. Even the doctor himself should be well educated to know what to prescribe.
I know doctors are very quick to prescribe antibiotics these days.
And sometimes some of the misuse of antibiotics stems from the pressure of patients. Patients walk in and they want these antibiotics, and the doctor is not able to, he feels boxed, because in case, of course, the patient does not need the antibiotic. Of course, if they need, then they are prescribed. So you find that the doctor is boxed to a corner and he ends up prescribing something. Of course, there are always interests around what should be prescribed. Now, when you talk about brands, original brands are...
Just before you get to the brands, perhaps at what age should someone start taking antibiotics? Because I keep hearing this debate that you shouldn't give antibiotics to minors and things like that. Is that factual?
No. We microbes or bacteria do not know children, do not know adults, do not know animals. So where they have found a host, they will affect the host, whether a child, a newborn, a neonate, and it's the doctor's, up to doctor's prescription to diagnose that actually the bacteria has found a host and we need to eradicate. So anybody can get antibiotics as long as they have the bacteria or the infection in them. Yeah.
All right, back to the question about the generic and original drugs.
That one is not really an issue here. It can only become an issue when you talk about poor quality drugs. So original brands are original. Yeah, like that's the patent. That is the first company to come up with that molecule. But they're usually very expensive. So you find that normally after 10 years, other companies are allowed to produce the same product using the formulary from the original company. And that is now, those are called generics. Generics.
So why are they cheaper if it's the same product?
Because at the beginning, only one company could produce, and that one company they have to recover what they spent in research. Research is very expensive. It can take 10 years to come up with a new molecule. So of course that company is patented and they have to recover what they spent. But after 10 years, when the patent is gone, any company is allowed to produce. So of course now you have hundreds of people producing the same thing. So of course now they need to compete to sell. But normally a generic product should have the same quality as the original. And that is of course up to the board, like the Pharmacy and Poisons Board, to ensure that our generics meet the standards that they should. Because when you have poor quality drugs, it also contributes to antimicrobial resistance, because then we are underdosed or we are overdosed. Yeah.
All right, let's look at our scenario here in Kenya and perhaps the regulations that we have. Almost every street corner you'll find a chemist, you'll find a pharmacy. And we are very fond of walking in and, asking the pharmacist, I have this condition, what should I take? And they will be quick to prescribe something for you. How do we deal with this as a country? Because we keep talking about it, but doing nothing.
Okay, actually, this is a global issue. And in 2016, there was a UN General Assembly where Kenya participated and gave its commitment to fight this issue of antimicrobial resistance. Now, there were global action plans that were launched, and each country was given up to 2017 to come up with their national action plans that mirror those that were in the WHO. Now, in this national, now Kenya in 2017, last year, had launched a national action plan and a policy. The national action plan were the is a 5-year framework on how to implement this policy. Now, in this policy, that's where now regulation will come in. That's where issues like awareness creation will come in. And this year, we launched a communication strategy, which is supposed to educate the mwananchi, the stakeholders, the practitioners, so that we change their behavior towards antibiotic. Because behavior change is a very big way, even bigger than regulation. And again, we launched the surveillance strategy, which will be tracking how this issue is growing or reducing. So the implementation of the policy has not yet started, but it's ongoing. So there are still measures that needs to be taken for it to be implemented. So we hope in 5 years' time, maybe there will be guidelines that will guide us on how these medicines will be sold, how the patients will access them, how the doctors will prescribe on such issues.
So we are likely to see a major change in the next 5 years.
Yeah.
All right, let's talk about, the ongoing campaign regarding this long week where you have been talking about the antibiotics resistance.
So actually the campaign has there are different aspects because there are different targets. But one of the main and the first target in this campaign is awareness, creating awareness about the seriousness of the issue. When you say that it's projected by the WHO, that is the World Health Organization, that by 2050, we might have 10 million people succumbing to resistant bugs. And 4.5 million of those are supposed to be in Africa or in developed countries. So that's a serious issue. So we need to create awareness in the government itself, within the health practitioners themselves, and within the mwananchi, that this is a serious issue.
So how have you structured your campaign, your awareness campaign?
So we've structured it, he's more on the ground.
On 8th this month, there's a breakfast meeting. We've done activities that either create awareness or are geared towards research and surveillance. So we started the other week on 8th of this month. There's a breakfast meeting just for media breakfast meeting, just for media to help us create awareness through maybe radio, television like these ones, newspapers.
So this is part of the campaign.
Yeah. And again, on Monday last week, that is the 12th, actually globally it was scheduled to be from 12th to 18th of this month. So on 12th we had we had a march just in Wangige. We had a demonstration. We marched along the street to educate farmers, wananchi, and practitioners. We talked to them one-on-one, just to feel if they know about this issue and how they do. Then on Tuesday and Wednesday, we had a scientific conference, mostly by researchers who came and presented their research work, where they are, and figures that show us how surveillance, which was done at Calro, at Loresho. Then there have been other activities like media shows like these ones. We have gone through several media houses. There have been articles written on newspapers. And that's the whole thing we are doing.
So other than the 1 week campaign, what is your sustainability plan in terms of keeping that message out there?
Now, the second strategic objective of the National Action Plan is surveillance. There's a committee called National Antimicrobial Stewardship Advisory Committee, which is heading all these activities. It's actually an interministerial committee composed of the officers from the Ministry of Agriculture, Livestock and Fisheries, and officers from the Ministry of Health. So they are the ones who do this surveillance and awareness creation within the people, the farmers. And as you realize, this issue is also very big in animals. I'm a veterinarian, so I know
it's not just about the human population.
It's not only humans.
Animals. Okay.
Because one of the main big issue with animals is antimicrobial residues. Because once maybe an animal is treated with antibiotics, there's some period you're supposed to observe before you consume its product. Either it's milk, egg, meat. But you realize that most farmers do not observe that time. Maybe if you're supposed to observe 3 days, then this farmer sees that he'll lose a lot of money if he pours milk for 3 days. So that's one other big issue.
Anyway.
Yeah. So that's one of the other issue we are trying to teach farmers, that to have good practice. Don't look at themselves getting money, but also think about other people and consider this as a huge problem. Yeah.
That brings us to the question about the cost. Is there enough money being put towards research to try and ensure that we also get other ways in which we can be able to fight some of these diseases?
So actually, Kenya is a part of all these, the treaties. Is a signatory of all, to the treaties which surround antimicrobial stewardship programs, and that is actually the 5th strategy point, to ensure that we as a country invest enough in antimicrobial surveillance and in resistant programs. So that is the 5th strategy. And like I said, this is we are at the start of it. We started in 2015. But once the WHO gives a figure or a percentage that Kenya should invest in that, then of course we have to do that.
What about in terms of diagnosis?
In terms of diagnosis?
Yeah, the investment.
Diagnosis of?
What is it called? Bacterial infections.
That is still, of course, that is still it's an ongoing thing. So it's not only about antimicrobial stewardship. Overall, in health, we always have a percentage of the money used in health that should go towards research. Research, in this case, research of like surveillance, to see where we stand. Yeah, of course, when it comes to research of new products, those are more global. Here we tend to talk about more of surveillance, but those are things which are ongoing. Okay. And a percentage of our GDP, of our health budget should go into that.
Maybe to add on to diagnosis, it's one of the things that we're trying to talk to to the practitioners, both veterinarians and human doctors, that sometimes you may need to confirm the diagnosis before you give antibiotic. There is this simple test called culture and sensitivity test, which the doctor can find out, can take a sample from a patient and subject that sample to a certain growth. Then once those bacteria grows, he can subject them to certain different types of antibiotics. So he'll be able to identify which among these antibiotics is best for this person's condition. So those are practices that we are also advocating for that can help us fight these diseases. You find that instead of using an irrelevant antibiotic, this practitioner will use the best antibiotic and cure the disease.
Specific bacteria. Okay, I'm informed our time is up, but I'll just give you a couple of seconds to give us just the do's and don'ts to try and ensure that we fight the problem of antibiotic resistance. So you can just look into the camera and speak to the Kenyan people.
So Kenyans, please, antimicrobial resistance is a big problem, is a growing problem. Maybe in the few years we'll not have any antibiotic to treat simple diseases like maybe cholera. Diseases that used to be treated before, but now we cannot treat them. Either it will take long to treat or it will be too costly, and maybe you will have to use medicine that have quite a huge resistance or maybe side effects. So please follow advice from veterinarians fully and the doctors fully. Only use antibiotics on prescription and make sure that you use them when it's on need, and only get them from authorized sources. Please, we beg, use antimicrobials prudently. Thank you.
Dr. Jill?
So what I can say as a pharmacist, I would urge every stakeholder, in this case we talk about, everyone has a role to play. The patient has a role, the health practitioners. What I can say to the patients, that antibiotics should be given on prescription, meaning you should see a doctor or you should see a clinician. Then with that prescription, you should go to a chemist or a pharmacy, which is accredited. And to the pharmacists, to be able to interact with their doctors if they feel that the prescription should be better. To the pharmacy technicians, I urge you to honor the prescription. If you are not able to honor the prescription, always send the patient back to the prescriber. When it comes to the health practitioners, let us do even simple hygiene to fight infection, washing hands between patients, disinfecting, and read more and understand more on how to prescribe best, to prescribe the right drug for the right at the right dose for the right indication. And for the patient, once you get your drug and you go home, finish the drug. As much as you might feel better after 2 days, please finish your medication and take it correctly.
I'm tempted to ask for free consultation for my cold. I know it's viral, but I still want to take antibiotics. But thank you both for coming to our studios this evening. And of course, sharing with us what you're doing to try and raise awareness on antibiotic resistance. Of course, I've been talking to Dr. Jill Mutua, who is a clinical pharmacist, as well as Dr. Nchagwa Chacha, who is an epidemiologist, just shedding more light into the ongoing campaign. And of course, the most important thing is before you pick up that antibiotic, make sure it is prescribed. On that note, it's time for us to wrap up your health, but business news is up next.